It's quite dark behind. Okay, never mind. Okay, so hi everyone. The name is Jimmy. As you know, I'm a counseling psychologist in Jimmy Ray Counseling. Jimmy Ray Counseling is my private practice all the while. I am actually a little bit about myself is that I'm trained in AADK, Agency Anti-Dadah Kebangsaan. In English is Anti-Drug Agency of Malaysia. So if you do not know, ADK is actually a rehab plus a detention center. Okay, so basically, when the authorities they caught drug addicts, especially, right, what they do is that they'll sentence them to 2 years in this detention center, right? So my job there is to do rehabilitation counseling, right, in terms of drugs addiction, right? So what I do is day in, day out, I do counseling with them to prepare them after the 2 years when they are released back into the society. So that's what I do. Okay, I was trained there, and I'm also a fellow member of UMCAS, which stands for University Malaya Center of Addiction Science. Okay, in this UMCAS, there are a lot of addiction specialists, including doctors. Okay, so we are all networked together. So we all often keep up to date on the latest things about addiction. Okay, I was also attached to a private rehab center, a renowned private rehab center in Malaysia for a short while. And throughout my career of like right now, I'm actually 5 years or more. I was attached to multiple NGOs, including a religious organization. Okay. Why do I touch on this subject? Understanding addiction is because I think addiction is one subject that has not been covered a lot uh, by the public, right? Which I think is vital because in terms of treating addiction and helping clients with addiction, you need the society needs to know what is addiction all about so that they can actually play a supportive role to the people who are suffering from addiction, right? So let's not waste some time. Let's get to it. All right. Okay, so today's agenda, I'm going to split into three topics. Okay, the first one is what is addiction. I'm going to explain what is addiction all about. And the second one is more about the science of the addiction. Okay, is addiction a choice or is it a disease? Okay, and the third one, I will touch a little bit about intervention. So how addiction intervention is done. All right, let's get to it. So what is addiction? Okay, so in order to answer this, these are some questions that you can actually try to answer yourself. So, can you describe addiction in your own words? So, what? People with bad moral values, people with weak willpower, people who are addicted to drugs, right? When I was young, I often think whenever it comes, whenever the name addiction comes up, I will think of drug addiction. But actually, there are many types of addiction. So yeah, what addiction types are there? Are there good addictions, right? So if you think about it, right, workaholic, is it a good addiction? No, you're hardworking, right? Your boss like it if you're a workaholic, right? Shopaholic, is it a good addiction? The retailers like it, right? Yeah. So how do you determine that someone is addicted, right? What is the fine line when before you tell that person, hey, I think you're addicted, right? What is that? You know, and why do addicts keep going at it again and again and again and again? And how do you think addiction can be stopped once and for all? Can addiction be stopped once and for all? Right, that's a big question. And what do you think are the main cause of addiction? All right. So these are the questions to answer when it comes to addiction. Right. I will try to cover as much as possible. I will try to answer as much as possible on these questions here, hopefully by the end of the day. end of the session, you will get a clear picture, at least, on what is addiction all about. All right. Okay, so first of all, there are types of addiction. So I try to split it into two major groups. One is behavioral, and the other one is substance. Okay, so behavioral, you know, is behavioral based addiction. So it's like gambling, internet gaming, pornography, sex, working, shopping, right, etc., etc., etc. Okay, substance addiction is about the substance that people consume. Okay, so there are multiple substances which are arranged into a category by the effect of the substance. First of all, it's depressants. They are called also downers because it gives a feeling of like, you know, down, you know, it's like you're on a down mode. You know, it's alcohol, prescription for anxiety drugs like benzodiazepines, right? Xanax, Valium. They are they are very, very common prescriptions, right? Opioids like codeine. Codeine sometimes is found in cough medicine. That's why you can see why addicts go for cough syrup, right? Morphine, heroin, right? The next one will be hallucinogens. They let you hallucinate, right? Like cannabis, or people call it marijuana, right? Pill K, ketamine. Ketamine is actually used for, is actually horse tranquilizers, right? But people use it, right? And mushroom, okay? Then you have stimulants. Stimulants uppers, it gives you focus, it gives you, it stimulates your mind, you know? It gives you energy, like meth, right? You can go on and go on and go on, right? Why do people call thing Tao Yun, right? In Cantonese, you know, right? Meth. And prescription drugs for ADHD, right? ADHD, you know, Ritalin, Concerta, right? Uh, and then common things like tobacco, smoking, kratom. In local language, in Bahasa, we call it ketum, right? Daun ketum. So these are all types of addiction. There are also legal substances actually, but it's actually not meant for human consumption into your body system. It's meant for other purposes, but people are actually using it to cause that, to give that high feeling, right? So these are the types of addiction in general. Okay, so let's go to the second part. Is addiction a choice or disease, right? We'll try to discuss a little bit about the science of it. Okay, so before we start to go into detail of the science, we have to know a normal decision-making process of a human being, right? Everyone uh, are able to make decisions for ourselves, right? So how does decision making actually works, right? So I put this here, the chart here is, you can easily see, right? Usually when there is a problem, we try to define the problem, right? Then we choose a solution, right? If the solution doesn't work, we develop alternate solutions, or we have multiple solutions, right? Then we choose the best alternative and then we implement it. After implementing it, we evaluate it. Does it work? Now, if it doesn't, then we go back to the drawing board, right? So this is a rational choice decision making, right? But in addiction, it actually disrupt this, right? So I'll go in deeper. Right. I'm not going to play this video. You can actually find this video on YouTube, right? The title is Pleasure Unwoven. It's by Dr. Kevin McCauley. Right? He covers very, very detailed science about addiction, how it affects your brain and everything. Right? If you're interested, please go to the YouTube and watch this video. Right? Because if I'm going to play this video, it's going to take a long time. Right? I'm going to keep this video as short as possible. Yeah? Okay. So, first problem of addiction. Okay. So, when we look at the first problem of addiction, we have to look at our brain. Okay, so our brain actually consists of different parts, right? We have the frontal lobe, right? The frontal lobe actually helps us to make decisions. It keeps our memory as well, right? There is also the midbrain and the inner brain, but we're not going to touch the inner brain today, right? the midbrain controls our survival instincts. Okay, so basically, if you want to base it on hierarchy, the midbrain supersedes the frontal lobe, right? Even though we can be aware and make decisions, but sometimes you feel like not doing that thing. You know that doing that thing is right, but you don't feel like doing it, and ended up you're not doing it, right? Because of the midbrain effect, right? So the midbrain has power over the frontal lobe, and the inner brain actually even controls certain things that we can't even control, like our heartbeat, right? Like breathing, right? And all the organs, processes, and everything. So, but I'm not going to touch that because that is, I'm not a brain specialist. So I'm just going to touch on the frontal lobe and the midbrain because it's going to affect the addiction, right? It's related to addiction. Okay. Okay. So just know that midbrain controls your survival instincts and the frontal lobe controls your decision making. But your midbrain is more powerful than your frontal lobe. Okay. So what happens in a person who is suffering from addiction? Okay. So you know that the midbrain controls the survival instincts of a human being, right? So like the need for food, when we are hungry, we will have to find food. Okay. The feelings of safety, when we feel unsafe, we are often anxious, right? And we try to find a place where we can feel safe, right? And procreation, we want to further our genes. That's why people get married, people have children, right? So if addiction actually interferes with our midbrain, that means, in this case, I just put it as drugs. That that means the drugs now are more important than all our survival instincts here. Food, safety, procreation are no longer important. Drugs are number one. So you see what happens? And just now remember when I say that the midbrain is stronger than the frontal lobe. So when the midbrain is stronger and all your survival instincts are taken over by the drugs, do you think that a person can make a good decision making? Can have a decision making? No, it's not possible, right? Because it's even more important than their survival instincts. Yeah? So that is the main uh, cause of addiction. Okay, so I'm from before I come into the uh, mental health industry, I was in the pharmaceutical and medical device industry for decades actually. Yeah, I was in the corporate. So I'm going to touch a little bit about the pharmacodynamics of addiction. So pharmacodynamics means the reaction of the drugs in the body. Okay, so there are two pathways that we are looking at here, right? First is the brain reward system, and the second is the brain memory system, right? Okay, so for brain reward system, uh, when we are happy, when we are getting acknowledged, when we have certain achievements, right? Our body system naturally will release a dopamine. Dopamine here I put it as a neuromodulator molecule that gives the feelings of pleasure, satisfaction, and motivation. Why? Because these are the things that can benefit us. So our brain will naturally release the dopamine, make us feel the pleasure, make us feel satisfaction, and make us feel motivated to continue doing the good things. Right? That is how our brain works. Right? So if you can see down here the chart, right, the natural rewards, you can see every time when we do something right, it spikes, right, the dopamine release, right, and over time it will go down, right. But if you look at the addiction rewards, the spike is much higher than the natural rewards, right. So if a person who is suffering from addiction, especially drugs, right? This can apply for behavioral as well. So every time when you repeat the same behavior, that the behavior can give the dopamine spike more than your natural rewards. Thus, excuse me for a second. Okay. So when the addiction spike is much higher than the natural rewards, what do you think? The natural rewards are no longer satisfactory, right? A person who is suffering from addiction will continuously look for the ones that gives a better spike, right? So for example, here I just give you a very simple example. Somebody offer you 100 ringgit to do some job. Let's say drive someone to hospital, right? Then before you agree, another person came and offer you 10,000 to do the same thing. Which one would you go for? Right. So this is the natural occurrence of things, right? Okay, so this is the brain reward system. Now, so now you know that addiction, uh, once it affects your brain, your reward system, right? You will no longer be in control, right? So now my question to you is, do you now know, is addiction a choice, or do you think that it's a disease? After my explanation, right? Because it affects the person's ability to make a decision, and it takes over, it sort of hijacks the midbrain, that survival instincts are no longer important. Drugs is number one. So that's why a person who is suffering from addiction will continue to go for the substances or the behaviors that is giving them the highest dopamine spikes, right? So I would call that actually addiction is a disease of choice, right? The disease that makes your brain incapable of making rational choices. That is the right thing to call addiction, right? So it's a disease. So if you know it is a disease, how should we view the people who suffers from addiction? Should we still say that, oh, this person, lack of willpower, lack of moral values, useless, weak, you know? Should we judge them? Just like, for example, if somebody suffers from heart attack, do we judge them being weak? Or suddenly somebody is born with hypertension, or, okay, born with diabetes. Do we say that you are weak, you know? So if a person contracts a disease, we treat them like a patient. We don't treat them like a morally defunct person, right? Right. So how should we treat them? We should treat them like a patient. Yeah. So I hope that this will answer clearly, and gives a clear picture on what is addiction all about. Okay. So right now I'm going to the part 3. Okay, on the intervention part. Okay. So in terms of doing intervention for addiction, there's always a lot of things to look at, because I think addiction, every human being is unique. Every human being is different. They grow up in a different environment. So there is no one size fits all kind of intervention, right? Every person who is suffering from addiction is different. Okay, so first of all, I will have to look at the triggers. I'll look at the gratitude. There are so many, and this list is actually non-exhaustive, right? It goes on and on and on and on and on. Yeah. So okay, I think the next uh, slide will explain better. Okay. So if you can see here, the tree of addiction. A person can be addicted to tobacco, drugs, food, gambling, sex, work, alcohol, whatever it is. That is the symptoms on the outside. But what is the main cause of the addiction are deeply rooted. Things like anger, things like shame, things like heredity, right? Heredity factors, things like grief, loneliness, fear. So there are so many things that we have to dive deep. You know, we cannot just say, you are addicted to this thing. Stop doing it lah. It's not so easy, right? Let me give you an example. It's like for those people who used to say that, you know, I have when I was working, you know, I've seen a lot of people who needs to drink a cup of coffee to start their day at work, right? Okay, so can you stop drinking coffee to start your day normally? Can you do that for 1 week? Can you do that for 1 month? Can you do that for 1 year? Can you do that forever? If it's very difficult for you, for drug addicts especially, yeah, for people who are suffering from addiction, it is much harder. Yeah. Okay, so this is an analogy for you to consider. Okay, so in the intervention that I do for them is that I will dive deep. I'll try to uh, address the root cause of the problem first, right? And it takes time. Addiction recovery is actually lifelong. Okay, it's lifelong. Even though people who has stopped uh, whatever substance or whatever uh, behavioral addictions that they used to for 10 years, it could come back. It could come back. Yeah. So yeah, this is the intervention. Okay. And in a lot of intervention, there is always this biggest obstacle, right? This is also a short video, but I'm not going to play this. If you're interested, you can actually go to YouTube as well. The title is There Is No Such Thing as a Dragon. So it's a children's story. And usually I will ask people after playing this video, I'll ask people, so do you think what are the moral values depicted in this story? Right? But here I'm going to reveal to you it's denial, right? So the biggest obstacle in doing intervention for addiction is denial. People who think that they do not have a problem until it gets too big to control, right? And this denial does not consist to the person who is suffering from addiction, but this denial can be from the family members as well. Family members say, oh, okay, lah, this person, you know, no problem, no problem, nothing wrong with him. Or they are in denial because they do not want others to know. Or it's a family thing, we should keep it secret. All right. And denial in the society as well, that every part of the society plays a very important role to help people who is suffering from addiction. Because if you do not help them, the only way they can go is to go back because everybody else is rejecting them. Right? So this is the biggest obstacle. Until today, it is still the biggest obstacle. You know, by coming to see me, coming for an intervention is good, but things has to change. If things do not change for the better, it's quite difficult. All right. So please address denial. All right. So in summary, I just want to say one thing, that addiction is not a choice, but a disease of choice. I believe that when more people, especially the family and close friends of a person who suffers from addiction, understands this, recovery is possible. Okay? Recovery is possible. Okay, so I just want to thank you for your attention here, and do remember to reach out, love yourself, and seek help. Thank you very much. Bye bye.